And welcome back. Thom Hartmann here with you, and Wendell Potter on the line with us. Wendell, what do you think is the area of greatest confusion for people with regard to the Affordable Care Act?
Well, there's great confusion that it even is the law of the land, and people don't know what's in it for them, and that's the biggest concern, the biggest problem. Since 2010, an analysis has shown that those who are opposed to the Affordable Care Act for economic and political reasons have spent $400 million at least against the law to try to mislead people, and only $35 million has been spent by supporters in the administration to explain it. There just hasn't been enough money to keep up with those who have a reason to try to dismantle it. And I thought the media too, quite frankly, because we haven't seen enough analysis of what the bill actually means to Americans. So it's no wonder that people don't know what's in it for them. They've been misled, and in many cases believe the lies, and they have been, just quite frankly, outright lies have been told about the law. I think that will change, and beginning tomorrow, people will be able to actually go online and find out how the law will affect them, how they can get coverage if they don't have it.
Yeah,
and there's a lot of information available already out there.
Yeah, healthcare.gov is a great resource. I understand that if somebody were to go online starting tomorrow and find the plan that they want from the provider they want and at the price they want with the rebates and everything, all this kind of stuff, and sign up for it, that it actually doesn't take effect until January 1st. Is that right?
That's right, and it's operating almost exactly the same way that people sign up for coverage at the workplace. If your employer offers coverage at one period of time every year, you have what's referred to as open enrollment. You have a period of time to look at your options and make a decision before the plan for next year will go into effect, and that's what we have going on here. There will be, the 1st of October is 3 months away from January the 1st when these policies will take effect. So you've got 3 months really to shop for coverage that will be effective on January the 1st, and actually you have 6 months to shop during this initial open enrollment period. So if you don't sign up by the 1st of January, you will still have 3 months to sign up. Your policy will begin after you sign up. But it's just the way health insurance has been.
Why do health insurance companies do that? I can buy life insurance every day of the year, but it used to be when I was on United Health Care, the only time I could change my health insurance policy was during the first 2 weeks of November, as I recall.
They do that because they want to make sure they get everybody they know of in the system so that they can make plans to be able to administer. They have to do the ID cards. They have to make sure that benefits are working. It is different from life insurance because there's so many moving parts of health insurance. They have to match up with physicians and hospitals that are in network. So it's just a considerably more complex operation than it is with life insurance, and so that's why.
So if the Republicans can convince people not to sign up before March 1st, will they not be able to sign up then? Well, let me ask you that on the other side of this break. Hang on just a second, okay?
Sure.
We're talking with Wendell Potter, health insurance industry whistleblower, author of Deadly Spin, wendellpotter.com, his website. We'll be right back. Stick around. 20 minutes past the hour. It's the True People's Media, the Thom Hartmann Program. Welcome back, 20 minutes past the hour. Wendell Potter on the line with us, the famous... You were a vice president, weren't you, Wendell?
That's right.
Yeah, with was it Aetna?
It was Cigna and Humana before that.
Cigna and Humana. Senior executive with a couple of major health insurance companies. You really know this business from the inside out. You wrote a book called Deadly Spin, blowing the whistle on the practices of this industry. And you know what's going on with Obamacare. So, first of all, starting tomorrow is open enrollment, and that runs from tomorrow, October 1st, until March 31st, if I have that right.
That's right.
And so that's a 6-month period in which you can enroll. What happens if, I mean, you got Republicans out here saying to young people, don't enroll in that program. And what happens if they listen to that siren song after March 31st and then maybe in April or May of next year, God forbid, they discover that they've got, a lump someplace or they're not feeling well or whatever, and they decide, maybe I better get some insurance. Can they do it?
Well, they may have. They might be able to get it outside of the exchange. It won't be that will be the only place where you can get coverage, but they might have some difficulty getting it. And here's the reason why: you don't want people to wait until they have until they know that they've got an illness or an injury to sign up. That would create what's referred to as adverse selection or a death spiral. You've got to make sure you've got people enrolled and understand the rules of enrollment so that they don't wait until they get sick. It has to be that way. Otherwise, the insurance companies just simply wouldn't participate in the program.
So, is it going to be a 6-month open enrollment period every year, and then 6 months where the window closes?
I think we'll see if that remains to be the case. I think there may be some changes, maybe some flexibility. That window may narrow, or it could stay the same, or it could be widened. But this is the first time, obviously, that this has ever been done, and I think that the Department of Health and Human Services and the state the regulators will be looking at this to see how well it worked and whether it needs to be tweaked in the future.
All right. Okay. Let's pick up some phone calls here. Dan in Tell City, Indiana. You're on the air with Wendell Potter, Dan.
Okay. My question is, if Indiana doesn't have any health care exchanges because of the Republican governors, where can I find out about the affordable health care benefits?
I'm really glad you asked that, because a lot of people are confused about what their states have done. States have the option of not expanding the Medicaid program in their states, and about half the states have decided not to do that. But every state, including Indiana, including Florida and Texas, and some of the other states that are not expanding their Medicaid programs right now, every state and the District of Columbia will have an exchange up and running, and it will go live after midnight tonight. So if you live in Indiana and you want to shop for coverage tomorrow, you'll be able to, regardless of what your governor and legislature has to say. The federal government will be operating the exchanges for a lot of states, and so I've heard that from a lot of people, by the way, that they've gotten confused because some states have not expanded their Medicaid programs to 2014, but that has nothing to do with the exchanges or the marketplaces.
So he should go to healthcare.gov, and it'll direct him to the place in Indiana where he can find the exchange?
Exactly. I think it'll be seamless for most people. You can go to healthcare.gov. You just click on the drop-down menu to indicate where you live, and then just go from there.
Yeah. Okay. Great. Coy in Land O'Lakes, Florida. You're on the air with Wendell Potter.
Greetings, Wendell Potter and Tom. It's wonderful to be on the air. I have a question that I'm trying to get a clear and concise answer to. First, let's start. Wendell, you have read the legislation, correct?
Yes, I have.
Okay. So could you tell us what enforcement mechanism is in place and what its maximum penalty is for the insurance company that denies you coverage that you are entitled to, that you paid for?
Well, it depends on how well this will be enforced. Will depend on the willingness and the resources of the states, because state governments, through their insurance departments, are responsible for the regulation of health insurance. At least health insurance that's bought by individuals, and it depends again on the resources and the willingness of those regulators to do that. Now, there will be penalties for noncompliance. Will the regulators enforce that? Remains to be seen. I think some states will be more vigilant than others. And the enforcement, the penalties can be significant. It could be $100 per infraction per member per day. So it can add up very quickly for an insurance company.
For an insurance company with millions of customers, $100 per customer can be hundreds of millions of dollars, in other words.
Yeah, over time it can be a big fine. So I think that there will be incentive for insurance companies to comply with the law. They'll want to. Bottom line, they often walk up to the line of what is legal, what's permitted. In some cases, they'll go over it, but they don't want to get slapped with a fine of any kind because of the potential for bad publicity as well.
Right. Patsy in Kylesford, Tennessee. We just have a minute to the break, Patsy, if it's a quick question.
Yes, I wanted to know, in Tennessee, I went to the website. They say that they're not offering this yet, the affordable health care. And I understood the answer just a few minutes ago, but I want to know, can seniors be involved in this affordable health care, and would it lower our costs? I have been using different supplemental health care insurance, but I wanted to know about that.
Thank you, Patsy.
Well, thank you, Patsy, and I'm a Tennessean myself. And yes, Tennesseans, just like the folks in Indiana, will have an exchange, and you can go to healthcare.gov and you can find choices in Tennessee. Senior citizens are benefiting already if you're enrolled. If you are Medicare eligible, and I expect that you are, if you get a Medicare supplement policy, already you have some benefits available to you. You can get preventive.
Let's get into the details of that right after the break, okay, Wendell? Wendell Potter with us. We'll be right back.